This lecture is intended for Nicklaus Children's Hospital Clinical Neurophysiology Fellows. It is the last of a 5-part series about EEG montages. It is helpful if this lecture is viewed after the first 4 lectures on the subject. This talk will be conducted initially in a conversation format, later in a question and answer format, and at the end I will make some closing remarks. As you know, montages distort the morphology and frequency of the potential they survey. Needless to say that there is no perfect montage. So, the best we can hope for is to use the right montage for the right occasion. Montages can be classified in many ways. In this frame, I have listed 3 classifications. The first one is based on spatial orientation. The second one is based on anatomical grouping. And the third one is based on the type of input going into the reference arm, usually called G2 input of the differential amplifier. The G stands for grid. Currently, most people will use the term E for electrode. The classification of montages based on spatial orientation is very simple. Sagittal montages go from the front to the back in the direction of the sagittal suture. They are best at preserving longitudinal spatial relation. Coronal montages go from the left to the right. They are called coronal because the electrodes are placed in the direction of the coronal suture. They are best at preserving transverse spatial relation. Montage classification based on electroanatomical grouping is more complicated. It is divided in unpaired and paired montages. Paired montages only have longitudinal arrangement. This is so because the head does not have a functional or anatomical symmetry in the transverse or coronal plane. Paired montages are good to display asymmetry because amplitude comparison between sides is made easy by this arrangement. Paired montages are further divided into pair group and paired channel montages. In pair group montages, electrodes from corresponding anatomical area are placed next to each other. In this example, left temporal area electrodes are placed above right temporal electrodes. In pair channel montages, the left and the right channels are stacked on top of each other, as you can see in this frame. The label of unpaired montage is used when channels are arranged in continuous anatomical neighboring sequences, such as we do in longitudinal or transverse bipolar montages. The electrodes in unpaired montages are arranged from the front to the back and from the left to the right. 2 effects of these montages are emphasized in many textbooks. One of them is the degree to which they distort the appearance of the background activity, and the other one is their ability to detect asymmetry. Unpaired montages distort the appearance of the background activity the least, but are worse to detect asymmetry. Paired group montages produce some distortion of the background activity. They produce more distortion than the unimpaired montages, but they produce less distortion than the paired channel montages. Paired group montages are fairly good detecting asymmetry. Paired channel montages distort the appearance of the background activity the most, but are said to be the best at detecting asymmetry in significant number of books. I personally do not think so. The last classification method I will present to you is based on the type of electrode or electrode group connected to input 2 of the differential amplifier. This classification divides montage in three groups. The first group consists of those montages with a single electrode connected to input 2 of each differential amplifier and the same electrode being connected to input 1 of the neighboring differential amplifier. A well-known example of this type of montage is bipolar longitudinal montage. The second group consists of montages that have the input 2 of each differential amplifier also connected to a single electrode, but this electrode is common to all the differential amplifiers. For historical reasons, when the two ears electrodes are combined and connected to input 2 of all the differential amplifiers, the montage is still considered in this group. The third group consists of montages with more than 2 electrodes combined and entering through input 2. These include Laplacian and average weighted montages. So, this ends the first section of this talk, and we are going to start the question and answer section. The first question is, spatial filtering only influences the amplitude of a wave. A, true, B, false. This frame, as you see, refers to frequency filters and not to spatial filtering. I am showing you this frame at this point to remind you that removing or allowing waves with different frequencies to contribute to the ultimate wave displayed in a monitor produces changes in multiple elements of a potential, such as onset latency, duration, peak latency, amplitude, waveform, and area. Well, the different montages, by virtue of their difference inter-electrode distance, the spatial relation among electrodes, and the arrangement of the electrodes entering input 2 of the differential amplifier also alter the elements of the waves that we have just mentioned. So the answer to this question is false. Next question. Which of the following factors are influenced by montage configuration? A, area occupied by the electrical field. B, voltage gradient of the electrical field. C, synchrony and coherence of the electrical potential constituting the electrical field. D, none of the above. In this frame, I have represented the flow of elements by the direction of the arrows. Electrical potentials generated by neurons create an electrical field that we, during recording an EEG, capture using montages as EEG potentials. These EEG potentials will appear as waves that have a very different arrangement depending on the type of montage we have used to collect them. When these potentials are captured using a bipolar montage, they will look one way. When they are captured using a common electrode reference montage, they will look another way. They will nevertheless translate to the same isopotential map. So, at the level of Newtonian physics, montages do not modify the electrical field they capture. We could argue, using deeper physics, that the observer by its presence changes the observed phenomena, but it is better not to go any further in that direction and just stick to the Newtonian thinking, at least for reading EEGs. So, in basic mathematical reality, the different montages do not change the electrical field, but in practice, the montage greatly changes the way we perceive the brain-generated electrical field. So the answer to this question is D. Next question. Amplitude is only influenced by distance between the probing and the reference electrodes. A, true, B, false. The effect of a spatial filtering, that is, filtering based on inter-electrode distance, spatial relation between electrodes, and degree of coherence between what is being received through input 1 and input 2 is particularly noticeable in relation to amplitude. If we have two probing electrodes localized at an equal distance from the source of an electrical field, the probing electrode matched to the furthest reference electrode will have a higher amplitude if both are only involved by the same field, as you can see, whereas I have tried to show you in this frame. This is true up to 10 centimeters. The amplitude of a potential is also related to the proximity of the probing electrode to the source. The closer the probing electrode is to the source of the electrical field being recorded, the higher the amplitude of the wave that it will create. So the answer to this question is false. Next question. Amplitude is only influenced by the distance between probing and the reference electrode and by the distance between the source and the probing electrodes. A, true, B, false. When the probing and the referential electrodes are both exposed to an electrical field with the same characteristic, that is, same morphology and chronology, the result is a flat line. Said in a different way, when the probing and the reference electrode are exposed to simultaneous and coherent electrical forces, a flat line will occur since the electrical forces will cancel out each other by virtue of the differential amplifier arrangement. When the probing and the referential electrodes are exposed to non-coherent or non-simultaneous electrical forces, an E.G. potential will appear. The less coherent or simultaneous the electrical forces are, the higher the amplitude of the potential will be. This may occur when the electrodes are exposed to two independent but coherent and simultaneous forces as depicted in this frame, or if they are both electrodes involved by a large enough field exposing both electrodes to the same voltage gradient. So the answer to this question is false. Next question. Which of the following montages is best to analyze broad, widespread potentials? A. Common electrode reference montage. B. Bipolar montage. C. Average reference montage. D. Average weighted montage. This epoch was recorded using a common electrode reference montage to the chin. It contains a broadly distributed EEG potential. I have shaded green the area of these discharges. As you can see, it extends from FP2 to O2 and it has a frontal predominance. This is the same epoch of EEG now viewed using common electrode reference montage with the common reference electrode placed on the neck just below the left ear instead of in the chin. I again highlighted in green the area of the EEG potential. The EEG activity extends from FP2 to O2 and it has a frontal predominance too. This is the same epoch but now using average as a reference. You can see that the activity still looks generalized, but now the activity appears to predominate over the posterior regions. This frame consists of the same epoch now viewed using bipolar montage. As you can see, the activity is greatly diminished in amplitude and it is basically restricted to the frontal regions. In this frame, as you can see, I have placed the same epochs view by the four montages so you can appreciate the effect of the different spatial filters capabilities of the montages upon a broad potential as the one shown in this frame. Please take a few seconds to review it. Imagine how different would the description of this event be if you choose to describe it based on the montage using bipolar reference instead of if you were to use the chin as a common electrode reference montage. Would you have described this potential as broadly distributed with frontal predominance as suggested by the common electrode reference montage using the chin, or the below the left ear reference? Would you have described this event as a posterior predominant discharge as suggested by the average montage, or as a narrowly distributed frontal potential, or miss it altogether if you just review the EEG recording bipolar montage? Traditionally, most electrocephalographers would describe this potential as few using common electrode reference montage, and thus refer to it as a broad distributed potential with anterior predominance. So the answer to this question is A. Next question. Common electrode referential montages de-emphasize potentials with narrow distribution and low amplitude. A true, B false. The figure in this frame depicts the impact of different montages upon the amplitude of a wave based on the extent of the area involved by the wave. I have in this frame divided waves depending on the area they involve in two groups. The first group consists of those that are broadly distributed. I have classified a broadly distributed potential as those that are captured in many electrodes. The second group is constituted by narrow distributed potential. A narrowly distributed potential implies a potential that is captured on the one electrode, or at the most two closely placed probing electrodes. The color match arrow indicates amplitude for the respective potential. The third variable in this frame are the different montages. In this frame, you can see 5 different montages. As you can see, a narrowly distributed EEG potential will have a relatively higher amplitude when compared with the amplitude of the rest of the ongoing activity when the review is done using weighted average reference montages than when reviewed using a common electrode reference montage. As you can see, the height of the magenta arrows in the different extreme of the frame are very different. The narrowly distributed potential when viewed by weighted average reference is very large, and this is represented by the size of the arrow or the height of the arrow, whereas the same potential when viewed in the common electrode reference is of a much lower amplitude. On the other hand, the amplitude of a broadly distributed potential is higher using common electrode reference montage than using average reference or bipolar montages. The amplitude of a broadly distributed potential is even more reduced in amplitude by the Laplacian and the weighted montages than by the previously two mentioned montages. We can summarize this that overall, a narrowly distributed potential is likely to be detected when using any type of montage, and this is true for all but the most restricted potential of the lower amplitude. In other words, all except the potential with a much restricted field and very low amplitude will be captured regardless of the montage being used, whereas broadly distributed potential may be missed or at least significantly diminished when we view them using bipolar, Laplacian, or weighted average reference montage. So the answer to this question is true. Next question. Bipolar montage de-emphasizes potentials with wide distribution and low amplitude gradient. A true, B false. Broadly distributed potentials that would be easily detected using common electrode montage will be greatly attenuated to the point that they may be missed using bipolar montage, and certainly would be missed if we use weighted average reference montages. So the answer to this question is true. Next question. The use of bipolar montage is not advisable when attempting to gain information regarding amplitude and phase of an EEG rhythm that involves two or more adjacent electrodes. A true, B false. An example of an EEG activity that involves two or more adjacent electrodes is alpha rhythm. In this frame, I am showing you an epoch using common electrode reference montage referred to the chin. You can see that the alpha rhythm is present in the two lower channels. In this new montage using a just below the left ear common reference, the activity can also be well appreciated. Here we see the same epoch view using average montage. Here the activity is still present posteriorly, but the amplitude is slightly decreased and it has moved more anteriorly. That is, the activity now can be seen in more anterior electrodes. Here, with a bipolar montage, the activity is significantly lower amplitude, and the highest amplitude is not present in the occipital channel. In this frame, I have compiled all four occipital, that is right occipital activity, to be viewed at the same time. As you see, I have used different montage or different derivations in order to make sure that you can appreciate the difference. So when bipolar montage is used, the appearance of the alpha activity is somewhat decreased in amplitude than when common electrode reference montage is used. So the answer to this question is true. Next question. Average reference montage is the best montage to diagnose alpha coma. A true, B false. As you can see in this average montage epoch, alpha activity is diffusely spread. The alpha activity in the frontal region results from the introduction to the average reference electrode of the widely distributed posterior dominant alpha rhythm. Also note the inverted eye movements potential occurring posteriorly. So the answer to this question is false. Next question. Localization of a discharge is best achieved using average reference montage. A true, B false. This epoch shows a 14 and 6 positive wave complex. The activity is clearly seen using a chin reference montage, as you can see in this frame. In this montage, the activity has a frontal predominance. The activity morphology and location is preserved now that we have changed from a chin reference to a just below the left ear reference. The activity is also clearly seen using average, but its polarity and location is greatly altered. It appears positive at FP2 but negative at T8, P8, and O2. Using the bipolar montage, it can be seen, but it is much less noticeable than before. In this montage, this activity still has a frontal predominance and it is positive in the probing electrodes. So the answer to this question is false. Next question. Average, common electrode reference, and bipolar montages when viewing the same electrical field will produce similar EEG tracings. A true, B false. It is obvious from the prior frames and questions that the answer to this question is false. But I wanted to show you the mathematical reasoning for this answer. So I chose to place this question here. The figure you are just looking at represents a negative field. In this frame, I have added electrodes as multicolored discs at different amplitude or voltage levels. If we use a bipolar montage, here expressed by the color rectangle matching the colors of the electrodes, the magenta electrode is 30 microvolts more positive than the yellow electrode. Hence, a downgoing wave will be generated by the recording EEG. We can make a similar analysis of the next channel and the next channel and the last channel. And as you can see, the EEG activity corresponding to these potentials in the montage will be easily interpreted. The electrode where phase reversal takes place is a maxima of the field, that is, the green electrode. Using a common electrode reference with the gray electrode pointed by the arrow as the common reference electrode will also have a simple mathematical distribution. As you can see, since the gray electrode and the magenta electrode are at the same voltage level, they will register no potential. Next will be minus or negative 30, that is, the yellow electrode is 30 microvolts more negative than the gray electrode, and so on with the other electrodes. And therefore, at the end, the EEG interpretation will also be very clear cut. The wave with the highest amplitude will be the maximum of the field. In this case, it will obviously be the wave under the green electrode. Using the average montage, we would take as the average reference to be negative 40. As the reference is going into the differential amplifier through input 2, what will happen will be that it will have to be subtracted from the voltage entering input 1. So this will require more complex mathematical operations and will yield a very confusing EEG pattern. So the answer to this question is false. Next question. 60 Hz artifacts were more prominent in common referential montage than in average reference montage when analog EEG machines were in use. A true, B false. This figure illustrates the words written on top regarding 60 Hz artifact. As you can see, in the old literature they were considered more intrusive when common electrode reference montage was used, less intrusive with average, and least intrusive using bipolar montage. The explanation for this was that the longer inter-electrode distance required to create a montage using common electrode reference was longer than the distance required to make a bipolar montage. Yet, with the digital EEG, since it collects all information using one common reference electrode and the different montages are mathematically reconstructed, it seems that 60 Hz interference does not appear to be more prominent with longer inter-electrode distance, as you can see in this record. This is a recording at 30 millimeters per second, and as you can see in this frame, C3 is the source of the 60th Hertz artifact, or at least is the electrode where 60 Hz artifact is more prominent. Notice that the amplitude of the electrical artifact looks the same regardless of the electrode used as a reference. The expected increase in amplitude of the 60 Hz artifact as the inter-electrode distance increases does not materialize. Using a reviewing speed of 60 millimeters per second, the unchanging effect of distance on 60 Hz artifact can be better seen. So the answer to this question is true. Next question. A potential with low voltage gradient will be emphasized by using a bipolar montage. A true, B false. One of the concepts that I like to use to help me visualize the difference in morphology of a wave recorded with bipolar montage or common reference montage is the power of the electrical potential generating the wave. If we were to have an electrical field with the characteristics present in this frame, that is a field with a maximum of a negative 70 microvolts and with a voltage gradient of 10 microvolts per division, and if we were to place electrodes in such a way that each electrode is 20 to 30 microvolts apart, the power of the potential captured using a bipolar montage or a common reference electrode montage, with the common reference electrode being at the theoretical neutral point, similar. So both will be rather similar. Please compare the green area in the bipolar montage and the green area in the reference montage. As you can see, they cover about the same area. But if instead the electrical field is still with the maximum of negative 70 microvolts, but with a smoother amplitude gradient, so that the electrode, despite being at the same distance as before, they are only about 2 to 3 microvolts apart, there will be a striking difference between the green area in the bipolar montage and the green area in the common electrode reference montage. Thus, if you consider the green area as representing the power of the potential, the one with the large voltage gradient and the one with the small voltage gradient, while looking very similar when represented in the common electrode reference montage diagram, they will look very different when represented in the bipolar montage. So the answer to this question is false. Next question. A broadly spread low voltage gradient spike is better recorded using a bipolar montage than using a common electrode reference montage. A true, B false. In this frame you can see a few bipolar derivations on top and a few common electrode reference derivations in the bottom. Now I have highlighted two areas, one in the bipolar derivation and another in the common electrode reference derivations. As you can see, the potentials are well appreciated using bipolar and common electrode reference montages. Perhaps it could be argued that it can be seen a little better on the bipolar montage. The potential can be clearly be seen in the bipolar montage and in the common electrode reference montage because it has a restricted area of distribution, a significant voltage gradient between the recording electrodes, and the degree of coherence of the potential among the electrodes involved is low. The newly highlighted areas in this frame only show a potential in the common electrode reference derivations. The potential is not seen in the bipolar derivations because the potential has a wide area of distribution, the voltage gradient among the recording electrode is small, and the degree of coherence of the potential between the closely spaced electrodes is very high. Anyway, remember that if a similar potential is coming into input 1 and input 2 of a differential amplifier, the potential will be wiped out. So the answer to this question is false. A spike with a restricted distribution is better recorded using a bipolar montage than when using a common electroreferential montage if the background contains high voltage slow waves. A true, B false. This epoch was recorded using a cephalic common electroreferential montage. The highlighted area demonstrates two potentials: a long duration widespread potential with a relatively small voltage gradient and relatively high coherence. This potential is preceded by another potential. This second potential is of a brief duration and it has a restricted area of distribution, a high voltage gradient, and little coherence among the electrodes. Now, using a bipolar montage, the previously well-seen long-duration widespread potentials with a small voltage gradient and high coherence are almost gone, and the preceding potentials can be well appreciated. The potential that can be better appreciated with bipolar montage was the potential that when viewed using common electrode reference montage had a briefer duration, a higher voltage gradient, less coherence, and was restricted to one channel. This frame highlights a similar event using a common electrode reference montage, and now the same event viewed using bipolar. So our ability to better see the spike using a bipolar montage stems from the appearance of a phase reversal and the ability of bipolar montage to eliminate coherent potentials. Coherence is more likely to occur with slow potential than with fast potential. Slow EEG potentials are more amenable to temporal summation than fast EEG potentials. So the answer to this question is true. Next question. When in the course of reading an EEG, you find a narrow negative phase reversal in a longitudinal bipolar montage, what should you do to plot the electrical field? A. Change to common electrode referential montage. B. Change to transverse bipolar montage. C. Change to average montage. D. Change paper speed to half speed, that is, to go from 30 to 15 millimeters per second. When in the course of reviewing an EEG you find a narrow phase reversal, the best way to localize the maximum of the field is to create a montage using the electrode at right angle to the electrode hosting the phase reversal. So once a narrow phase reversal is encountered in the sagittal plane, you should build a transfer montage at the right angle from the electrode that the phase reversal takes place. So the answer to this question is B. Next question. When in the course of reviewing an EEG, you find a white negative phase reversal in a longitudinal bipolar montage, what should you do first? A. Change to common electrode referential montage. B. Change to transverse bipolar montage. C. Change to average montage. D. Change paper speed to half, that is from 30 millimeters per second to 15 millimeters per second. This bipolar longitudinal montage presents a white phase reversal. The maximum of the field in the same plane can be determined by changing to common electrode referential montage, as you can see in this frame. Here it has been changed from bipolar to reference under the left ear. Further localization would require placing electrodes at right angle from the maximum as detected by the common reference montage. So the answer to this question is A. Next question. In a common electrode referential montage, the tallest potential always represents the maximum of the field. A true, B false. Given the same electrode position for G1 and G2 going into a differential amplifier, a stronger field will produce a higher EEG potential, but a weaker source captured with a longer inter-electrode distance may produce a larger potential. The weaker field with the longer inter-electrode distance is in this frame at the bottom. Hence, when judging the presence of a maximum in a common electrode referential montage, which is primarily done by amplitude, the inter-electrode distance should be taken into account. So the answer to this question is false. Next question. The common electrode reference can be chosen by selecting the electrode most distant from the maximum. A true, B false. This brief bipolar epoch shows a maximum likely to be at P4. O1 is rather quiet. Creating a new montage using O1 as a reference will show that the maximum is at P4 in the sagittal plane. So the answer to this question is true. Next question. The maximum of a field can be verified by creating a new montage using the apparent maximum as the common reference electrode and confirming that all derivations deflect in the same direction. A true, B false. The answer to this question is yes, it is true, but only if the field is the product of a vertical dipole, hence with only one pole facing the scalp electrodes. In the next few frames, I will enumerate the steps needed to determine the maximum potential of a field using the hot electrode method. And in the following frames, I will provide you with an example. Starting with a bipolar montage, the first thing you must do is guess the maximum. Next, you should use it as the common electrode to create a common electrode reference montage. Third, if in the new montage all channels go in the same direction, you found the maximum. Fourth, if one or more than one channel deflects in the opposite direction, you guess wrong. Fifth, use the electrode that goes the further in the same polarity direction than the wave just used as the new common electrode to create a new common electrode reference montage. 6. If in the new common electrode reference montage all channels go in the same direction, you found the maximum. If potentials go in different directions, you are likely dealing with a horizontal dipole or an artifact. I will now show you an example. This frame shows a bipolar longitudinal montage with a few significant electroencephalographic elements. I have highlighted one of them as the likely maximum of the field, but the presence of the elements above casts doubt on the location of the maximum. I have introduced in this new frame a brief epoch of transverse bipolar montage. A phase reversal is present at F4, maybe at C4, and certainly at P4. I have introduced this epoch to show you how to select the maximum of the field among these three possibilities. I will start by using F4 as the common electrode to create a common electrode reference montage. Please notice that I am using F4 as the common reference. As you can see in this new frame, I have highlighted the potential in question. Now I have placed by the side of each potential an arrow in the direction of the potential. As you can see, not all the arrows go in the same direction. This implies that F4 is not the maximum. And also notice that the largest relative negative potential is P4. Now I will continue the process by considering if C4 is the maximum. For this purpose, I have created a montage with C4 as the common reference. As you can see in this new frame, I have used C4 as the common reference and I have highlighted the potential in question. Next, I have drawn arrows in the same way I did before, that is in the direction of the potential. Not all the arrows go in the same direction. This finding tells us that C4 is not the maximum, but also notice that the relatively most negative potential or the relative most negative potential is P4. Now I have introduced the new epoch with a new montage. This time I am using P4 as the common reference electrode. Remember that P4 has been the highest most negative potential in the other two prior epochs, thus now making P4 electrode the best candidate for the maximum of the field. In this frame, I have highlighted the potential in question again. As you can see, all potentials are in the same direction pointed by the arrow. Hence, all of them are more positive than P4. Therefore, P4 is the maximum of the negative field, that is the electrode under which the highest potential of the electrical field is found, or the minimum of the positive field. An isopotential map can be easily drawn using the maximum or the minimum of a field. If you have difficulty understanding the concept of maximum and minimum of a field, you may want to see the other videos regarding montage that I have put in YouTube. Especially, you should see the one about common electrode reference montage. So the answer to this question is true. Next question. Isopotential maps are easily created based on the result of common electrode references. A true, B false. This frame has the last epoch I use when answering the previous question. As you can see, all arrows go in the same direction, but not all arrows do so for the same distance. In this frame, I have introduced a map of the head, and now in the corner a set of values. P4, since it is connected to itself, will present as a straight line, as you can see in this frame. I have opted to consider it the maximum of a negative field. The potential that deviates the least from P4 will be the next highest point in the field, that is T6, as it is represented in this isopotential map. Next is O2, and then is C4. So the answer to this question is true. Next question. The tip of a potential can best be appreciated by changing the reviewing speed from 30 to 60 millimeters per second. A true, B false. This epoch is being reviewed at 30 millimeters per second. The tip of this potential coincides with the tip of this other potential, or at least they appear to do so. Now at 60 millimeters per second, you can see that there is a discrepancy between the tip of this potential and the tip of this other potential. So the answer to this question is true. Next question. 14 6 positive waves will be underestimated by only reviewing an EEG using longitudinal bipolar montage. A, true, B, false. By looking at this bipolar montage, it would be hard to believe that it hides 14 6 positive waves. The presence of this element can be appreciated in this epoch using average, but is very clear in this epoch using beneath the ear reference and in this epoch using chin reference. So the answer to this question is true. Which of the following graphemes will be underestimated by only reviewing an EEG using longitudinal bipolar montage? A, 14 and 6 positive waves. B, alpha rhythm. C, small sharp transient of sleep. D, all of the above. This is another example of bipolar montage hiding 14 and 6 positive waves. This is the same epoch, now using common electrode reference montage linked to both ears. As you can see, the 14 and 6 positive waves become clear in this montage as compared to when we were looking at the bipolar montage. I have changed the reviewing speed in this frame to 60 millimeters per second to make it a bit clearer. And in this new frame, I have highlighted the element so you do not miss it. I will use this new epoch to analyze now alpha rhythm. The arrow points to the right parieto-occipital channel and now to the left parieto-occipital channel. The arrow now is pointing to the right temporo-occipital region and now to the left temporo-occipital region. The presence of alpha activity in these channels is highly questionable. This is the same epoch but using common electrode reference montage. Both ears are linked as a reference. You can clearly see the activity in the right occipital region and in the left occipital region. When I mean the activity, I am referring to the alpha rhythm that is now very well and easily seen. You can also see it with O1 and O2 are linked in this epoch. This frame consists of various segments of EEG from the same patient. As you can see, this is from the EEG primer. In it, you can see highlighted small sharp sleep transients. Now I have added a channel with a long inter-electrode distance which allows better appreciation of the small sleep sharp waves. You can see this in both sides. So the answer to this question is D, all of the above. Next question. The first reading of an EEG should be done using A, average electrode reference, B, common electrode reference, C, bipolar montage, D, Laplacian montage. It is probably appropriate to use bipolar montage for the first reading as long as sagittal and coronal planes can be simultaneously displayed, as I have done in this frame. So the answer to this question is C. This concludes the question and answer section of this talk, I will now make some closing remarks. These closing remarks will be divided in two parts. In the first part, I will summarize the good and the bad about the most commonly used montages. In the second part, I will provide you with a roadmap. That is the roadmap that I use most of the time to read an EEG. So to start with the good and the bad of each montage, I will start with bipolar montage. Bipolar montage is a series of adjacent derivations connected with each other. They are classified as having spatial path qualities. I like to think of them as having broad spatial filter effect. Just remember that the term path in connection to neurophysiology means that it allows the named component to go through and become part of the displayed wave. On the other hand, the term filter means that it blocks the set component from going through, and therefore that component does not become integrated in the displayed wave. The bottom line is that they filter out EEG potentials with low voltage gradient among the probing electrodes. Low voltage gradient is more likely to be found in slow frequency EEG activity, let's say delta wave, than they are to be found in fast frequency EEG activity. So they filter out slow background activity, making localized sharp wave easier to see. An analogy I like to make is that bipolar montages blur the background and highlight the details. In bipolar montages, localization is achieved by phase reversal. Bipolar montages are reliable to analyze waveform and polarity, but the absence of a common background translates to draw a mariner's analogy that we are comparing one wave against another wave without taking into account the sea level. Bipolar montages are good to detect highly localized EEG potential, even those with low amplitude, as long as a large voltage gradient exists within the field creating the potential. They are poor detectors of widely distributed potentials with low voltage gradient among the recording electrodes. They are excellent to detect electrode artifacts. They are adequate to detect asymmetries as long as longitudinal and transverse derivations are viewed simultaneously, and they display the background activity fairly well as long as we remember that they are judging each wave against other waves and not taking into consideration the sea level. Next, I'd like to talk to you about common electrode reference montages. Common electrode reference montage display potential differences between each electrode and the common reference electrode. The spatial filtering effect of common electrode reference montage has been described as a spatial low pass filter because they tend to capture potential with low voltage gradient. Capturing potentials with low voltage gradient provides two effects that, depending on what an electroencephalographer wants to do, are advantageous or disadvantageous. It will allow to see slow and sharp wave produced by electrical fields with low voltage gradient, but it will obscure narrow potentials with highly voltage gradient by virtue of them letting slow activity with low voltage gradient to go through. Localization is done by amplitude. This is very reliable, but only when the reference electrode is equidistant to all the potentials in question. Waveform and polarity analysis is very accurate if the reference has been well chosen. The ability of this montage to detect local neural sources is poor since it de-emphasizes highly localized potential of low amplitude. Common electrode reference montage is excellent to detect and analyze widely distributed neural currents. They are good at detecting electrode artifacts. They are good to detect asymmetry, and they are good to display and analyze background activity. Next, I am going to summarize some relevant points regarding average reference montage. Average reference montage display potentials differences between each electrode and the average of the entire array. The spatial filtering capacity of average reference montage is intermediate between bipolar montage and common electrode reference montage. Average reference montage are not as good to detect highly localized low amplitude EEG potential as bipolar montages, but they are better than common electrode reference montage for the same purpose. Average reference montage detect potential with low amplitude gradient better than bipolar montage, but not as well as common electrode reference montage. Average reference montage localized by amplitude and phase reversal, but their use for localization is very poor and often yield confusing results. Analysis of waveform is also poor using average reference montage. The ability of average reference montage to detect localized neural sources is adequate, except if the amplitude of one or a few electrodes are so different from all the other electrodes that they dominate the average. Average reference montage are adequate to detect widely distributed neural currents, but they suffer from the same problem I mentioned regarding few electrodes overwhelming the average. There is a discrepancy regarding the efficiency of average reference montage to detect electrode artifacts. I lean more towards average reference montage not being very good to detect electrode artifacts. Average reference montage are adequate to detect asymmetries, and average reference montage display background activity unreliably. They do so because of the possibility of the average contaminating the probing electrode. Source localization montages refer to Laplacian and average weighted montages. In the context of this discussion, I will restrict it to Laplacian montage. Laplacian montage display potential differences between each electrode and the weighted average of the surrounding electrodes. Source localization montage, that is Laplacian montage, are better at detecting highly localized potential with low amplitude than bipolar montages. Localization is done by amplitude, waveform, and polarity analysis is fair. Laplacian montages are excellent to detect highly localized low amplitude potentials. They are poor for the detection of widely distributed potentials. Laplacian montage detects artifacts adequately. The ability of Laplacian montage to detect asymmetry is considered good by some and adequate to poor by others. And the ability of Laplacian montage to display the background activity is considered good by some electroencephalographers. So now I will start the second part of the third section. That is the second part of the closing remarks. I will use the next few minutes to give you the roadmap I use to choose from the different montages the correct one for each occasion. In general, my approach to reading EEG is to formulate a tentative conclusion after reviewing a few epochs of an EEG. Then, to ask myself as I look at each new epoch if what I am seeing in that new epoch makes me consider changing my mind regarding my previously arrived tentative conclusion. If the answer is no, then I go to the next epoch. If the answer is yes, then I stop and analyze the epoch by going through the same process I initially used to arrive to a tentative conclusion in the first place. This is certainly a very busy frame. Do not get frightened by its complexity. I will explain it little by little. First, I like to tell you that there are many ways to skin a cat and just as many ways to read an EEG. This is how I do it most of the time. As I previously mentioned, I think the first read of an EEG should be done using bipolar recordings. Current monitors are large enough to allow simultaneous viewing of longitudinal and transverse derivations. Initially, I look for sharp waves in the first epoch. If I see none, I look for background abnormalities. If no background abnormality is present, I go to average reference montage. I again look at sharp waves and background abnormalities and consider if the EEG is age appropriate. If it is appropriate for age and I do not see background abnormalities or any sharp activity, I register that epoch as normal. I do this process for a few epochs, looking at the same parameters. I conclude that everything looks well. I go ahead and tentatively formulate a conclusion. That conclusion is that the EEG is normal. I then start the process of asserting or opposing my tentative conclusion with each subsequent epoch. If, on the other hand, the answer to my initial question regarding sharp activity is no, as it was in the first time, but the answer to the question regarding the presence of background abnormalities is yes, then I go to common electrode reference montage. I use as common electrode the quietest electrode that allows side-to-side comparison. So if I find an abnormality in the right temporal area, I try to get an electrode that is the same distance from the right temporal area as from the left temporal region, and in addition to that, that is quiet. Using this montage, I analyze the background abnormality. Depending on the robustness of the abnormality, I arrive to a tentative conclusion, or I repeat the same process in the following epochs before starting the process of asserting or opposing the tentative conclusion in the subsequent epochs. Now let's go back to the initial question. If the answer to the initial question regarding sharp activity is yes, I again ask myself if there is any background abnormality, but I do so not only in a general sense but also in the context of the sharp activity I had just encountered. Using this information, I arrive to a tentative conclusion regarding the background activity following the same process I previously described for the same purpose. I then go back to the sharp activity and look for phase reversals. If I find no phase reversal, I consider the need for extra electrodes, and if I feel they are necessary, I request a new study with added electrodes in the appropriate positions. If I do not feel additional electrodes are needed, I go on for a few epochs, and combining the information gathered from the presence of sharp activity and the background activity, I arrive to a tentative conclusion. Once I have arrived to a tentative conclusion, I move on with the process of asserting or opposing the tentative conclusion as I have mentioned in the past. If, on the other hand, sharp activity is present, as indicated here by the arrow, and this activity has a phase reversal, and the phase reversal can be localized to one single electrode, my next step is to triangulate the electrode where the phase reversal is taking place, either by checking the longitudinal and transverse derivations if they are already present, or creating a new chain of electrodes at right angle from the electrode with the phase reversal. If a phase reversal is present, but it involves more than one electrode, then I go to common reference electrode montage, and I use the quietest electrode possible to build the montage. I then ask myself if all the sharp activity in this newly created montage is going in the same direction. If all the sharp activity is in the same direction and all deflections are up, then the common electrode is the least negative, in which case the quietest electrode is the minimum negativity. If, on the other hand, all sharp activity goes down, then the common electrode is the least positive, that is the minimum positivity. Now let's go back to the question regarding the direction of the sharp activity on the common electrode reference montage using the quietest electrode. If the answer to this question regarding the direction of all the sharp wave is no, that is, if not all the waves are in the same direction, then the common electrode is neither the minimum or the maximum of the electrical field, and the reference should be changed. The change should be based on suspicion or using the hot electrode method. In the following frames, I will give you some suggestions as to how to choose the electrode to build a common reference montage. If the suspicion is based on pre-test consideration, you should choose the most suitable electrode based on that suspicion. For example, if you're thinking that you will find a benign Rolandic spike, it is best to choose a quiet electrode in the contralateral mid-temporal region to where you think the spike will be. Remember that these spikes often result from horizontal dipoles. A horizontal dipole should be suspected when there is a steep voltage gradient between the maxima of the two fields and a soft gradient on the opposite side of the maxima. If you are suspecting small sleep sharps, go to the contralateral ear. If you are suspecting temporal spikes, go to the contralateral ear if you are recording a cooperative patient during wakefulness. Or CC if the patient is awake. Avoid using CC if the patient is asleep. If you are suspecting 14 and 6 positive waves, go to the contralateral ear. If you want to gauge the amount of or the presence of alpha rhythm, go from one occipital lobe to the contralateral ear. If you have already reviewed the record and you suspect any of the elements I have just mentioned, you should follow the same recommendations. If, on the other hand, you have no clue after reviewing the record, then you should choose the reference based on the hot electrode method to further define the localization of the potential, or you may need to add electrodes and create a new montage. This method will usually get you to the right conclusion regarding the localization and extent of an electrical field produced by a vertical dipole. But at times, as you may have concluded, when a definite single field cannot be drawn, it may be that you are dealing with a horizontal dipole, or you may be dealing with an artifact. I hope you found this video useful. I hope it will encourage you to formulate your own system to orderly review EEGs. The system that you may develop may be different from mine, but as long as it works for you and your patients, it's good. Thank you.